Did you know that everyday medications like cholesterol-lowering drugs, painkillers, or certain antibiotics can increase your risk of skin cancer, especially in the summer when you're outside in the sun? And this isn't an isolated case, but it's also not meant to cause panic. There are actually over 300 active ingredients that can make your skin more sensitive to ultraviolet radiation. And you might even be taking some of them regularly without knowing it. And that's exactly why it's so important that you watch this video until the end. Because I'll show you which medications are especially critical, how to behave correctly, and why you still don't have to miss out on valuable sunlight. Many medications can make your skin more sensitive to light. This is called phototoxic or photoallergic. And that means, in combination with ultraviolet light, reactions can occur in your skin that may look like a severe sunburn in the short term, but in the long term can lead to real cell damage. And that's exactly what can increase the risk of skin cancer. But this isn't about scaring you or keeping you away from the sun. It's about knowledge, responsibility, and above all, a healthy balance. I want to introduce you to 3 groups of medications now because they are taken very frequently. There are many more of them, but if you already know these 3, that's already very good. First, there are statins, which are cholesterol-lowering medications like simvastatin or atorvastatin. They are often taken permanently, and studies show, combined with sunlight, they can increase skin sensitivity and cause inflammation. In the long term, this can even increase the risk of light skin cancer. This doesn't happen overnight, but rather quietly and gradually over the years. That's why it's so important to keep an eye on that. And the second group, those are antibiotics, especially here doxycycline and ciprofloxacin. These substances are known to cause phototoxic reactions. And if you go out in the sun while taking them, your skin can react strongly with redness, blisters, even burns. And here too, you should be careful not only while taking them, but also for 2 to 3 days afterwards. And the third group, those are painkillers like, for example, ibuprofen, the well-known ibuprofen that many people take. Unfortunately, sometimes they're taken like lozenges for mild headaches, muscle pain, discomfort, fever, or any kind of inflammation. But even these medications can make your skin more sensitive to ultraviolet rays. And you might not notice it right away, but your skin cells definitely remember it. And that's why if you've taken ibuprofen, you should avoid direct sunlight for at least a day. And now comes the most important part. If you're currently taking any of these medications, avoid direct sun exposure for the entire duration of taking them, and even better, for a few days afterwards, especially when taking antibiotics. So it's best to stay in the shade on those days, and of course, cover your skin with light-colored clothing. And in addition, during this time, use a sunscreen with a fairly high sun protection factor, and of course, wear sunglasses as well. Also, avoid artificial ultraviolet sources like tanning beds. And still, I don't want you to avoid the sun out of fear of skin cancer, quite the opposite. Sunlight is extremely important for your immune system, your hormones, and your well-being. But most importantly, you need it to produce vitamin D, and that doesn't work through a window. Shade and not with thick sunscreen. That's why my advice is very clear. Get 20 to 30 minutes of sun every day, but please without getting sunburned, and of course don't use sunscreen during that time. It's best to go out in the sun in the morning or late afternoon. What else can you do? It's simple. Read the package insert of your medications because there are many other medications that are also phototoxic. Ask your doctor, especially if you are taking medication regularly, or ask your female doctor specifically about how sun exposure interacts with this medication. And of course, keep an eye on your skin. Are there any new spots appearing, or does a spot suddenly start itching after sunbathing? and definitely have that checked out. And if you've been taking a medication for years, like statins to lower cholesterol, then maybe you could also ask yourself if there might be a healthier alternative. For example, through diet or exercise, because health doesn't mean just taking pills and the problem goes away. For me, health means understanding what's happening in your body and making decisions that protect you in the long term, not just calm you down in the short term. And if you know how medications affect your skin, then you can protect yourself and still enjoy and soak up the sun responsibly. Maybe you're taking some of these medications and didn't know it. If so, feel free to share this video with lots of other people.